Okay guys, hey, so for Emily's request, I'm making this video just so that people can kind of fully understand the outside screening process of patients who want to be seen outside rather than coming inside. So once a patient comes in, they do like normal, they get screened in the registration area, they get checked in. Registration will then call us back and tell us if the patient wants to be seen outside. At that point, you do need to go up there, but go in the registration box, talk through the window, wear your mask, but just find out, is it appropriate for this patient to be outside? If you, as use your nursing knowledge, if you decide that they are appropriate, then they're welcome to go out to their car. Ask them for their weight at that time. Check out kind of their arm size, see what kind of cuff you need, and then give them and make sure they have a mask to go to their vehicle and you know what vehicle they have. Come back to the desk, talk to the doc, put your quick triage in, and then you're gonna go get ready to go back outside. If the patient meets COVID criteria, you have to wear full PPE, gown, everything to go out. If they're gonna get flu and strep swab, which most of the COVID patients have been, you need an N95. So wear your N95 with the yellow mask over it, so that when you can save to reuse your N95, throw away the yellow one, save the N95, because then the outside won't be dirty. You also recommend double gloving, just because you touch anytime you touch a patient, then now your gloves are dirty. So after you touch something else, all those things are dirty too. So if you take off your dirty gloves, you still have gloves. It's just what we've been doing because it's easier. You don't have to, find what's best for you, but just a recommendation. You also want to try to limit the number of times you're going in and out, not the actual amount of time you're out there, but just the number of times to save on our gowns and all that stuff. So get your swabs, get your blood pressure stuff, get everything, go. Once you're out there, another recommendation, writing everything down first before you touch the patient. So get your history, get your allergies, get your meds, get all of that before you ever touch the patient, basically your whole second T. There will be a clipboard and a pen that you can use to write on. So we were saying to write on it, set it down, and then start doing your stuff with the patient. Start getting your vitals, start getting your swabs. At that point when you're done, you can take off your outside gloves, and so your new clean gloves to touch your paper that you're bringing back inside. The point really is just that if you have a dirty paper, you're now bringing the dirty paper back inside. You have no other choice. So if you can keep from touching it, that's what we're trying to do. The clipboard, try to keep the pen and the clipboard on the thing so that we don't get it disappearing, people going out there expecting it to be there. Don't take more than the cuff you need. They don't limiting the supplies that are getting contaminated. Once you get done with all your stuff, you'll come back in, the doc will go out, do their assessment, and then at that point, really your only other contact would be for treatments or to discharge. So the patients, what I've been doing is explaining it as it's safer for everybody else, safer for them, safer for us. So they're happy with it typically. We've also been putting notes in the chart though, saying they were assessed outside in case one comes back mad, because they are still gonna get billed like ER. So that's pretty much it. I don't know if you have any questions, I guess ask Emily, but it's basically just to make sure you're still doing your PPE, you're still getting your assessment, you're not contaminating as much, as little as possible, and then cleaning everything up.
Safety.
Emily's telling me safety. Safety what?
Essentially, you do need to either go out with a partner or to
Oh,
registration.
Yes.
So
Okay,
that way you're not getting kidnapped, essentially.
Yeah, we even talked about if the doc goes out with you, that counts. Like what I say, me and Jasmine were talking, like if Jasmine touches the patient, then I can just stand back. So you're not really getting exposed if you're 6 feet away. So just you just want to get kidnapped basically. Registration can watch you from the window. So yes, safe, be safe.
All right, thanks guys. If you have questions, shoot them to me and we'll get them all answered.